Good afternoon. My name is Adrian Dix, BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, September the 14th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, there'll be a written briefing with information about COVID-19 cases in British Columbia and other relevant information on the pandemic. As there will be Wednesday, another written briefing, and Dr. Henry and I will be here on Thursday. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you. Good afternoon. So we're reporting for 3 reporting periods today. From Friday to Saturday, we had 137 people diagnosed with COVID-19. Between Saturday and Sunday, there was an additional 119 cases, and from Sunday to today, we had an additional 61 people diagnosed, bringing the total for the weekend to 317 new cases, including 4 who were epidemiologically linked. Our total in British Columbia now stands at 7,279 people with COVID-19, and that includes 2,557 in the Vancouver coastal area, 3,754 people in the Fraser Health Region, 195 people on the Vancouver Island Health Region, 473 people in the Interior Health Region, 216 now in the Northern Health Region, and 84 people who reside outside of Canada. We've now are up to 1,594 active cases in British Columbia in all health authorities, of whom 58 now are in hospital, 16 of whom are in critical care or ICU. Sadly, this past weekend, we've had 6 additional people die from COVID-19, bringing the total to 219 people. And again, 5 of the 6 people were elders in our long-term care system, 4 in the Fraser Health Region, and 1 person in Vancouver Coastal Health. And we've had our first tragic death in the Northern Health area. Once again, our thoughts and our condolences go to the families, to the communities, the people who care for these loved ones who they've lost under these most difficult conditions. We now have 3,047 people who are under active public health monitoring and 5,446 people who have recovered. We have no new healthcare outbreaks, and in a bit of good news, we have 4 that are now declared over. The second outbreak at Holy Family Hospital is now declared over in the Vancouver Coastal Health Region, and there are 3 in the Fraser Health Region. The second outbreak that was detected at MSA Manor, one at the Sorney Alzheimer's Centre, and at the George Derby Centre are also all over now, leaving us with 13 active outbreaks in the healthcare system. And a total of 791 people affected, including 471 residents and 320 staff. We have no new community outbreaks, and the cluster that was associated with the Okanagan Correctional Facility has also been resolved and is now over. But there continues to be community exposure events that have happened in areas around the province. And I encourage people to continue to check health authority websites and the BC CDC website regularly. So COVID-19 has not left us, and it has required all of us to adjust our daily activities to ensure that we're doing what we need to do to keep those we are closest to and our communities safe. We must now all hold steady with our layers of protection and get ready for what we know lies ahead. We have to do our part and be ready for unexpected challenges like we are seeing right now with the wildfire smoke here that's impacting our communities across the province. I know how many people have questions about how to best protect themselves and their families when their air quality is compromised. And I want to encourage everybody, again, the information and resources about our wildfire smoke and your health is available on the BC CDC website. And we know that there are important considerations, particularly for people who have underlying lung disease or asthma, heart disease and diabetes. And we know that the mixture that we inhale with wildfire smoke has a number of particulates in it that cause irritation to the nose, to the throat, and to the lungs, and particularly affects people who are very young and our elders. And we know that they are the same people who can be most adversely affected from COVID-19. We know as well that pregnant women can be very affected by wildfire smoke. So those are the things we need to be concerned about right now. Outdoor exercise should be avoided right now until the sky's clear. As well, we know that mask wearing can help, if it's tight-fitting, can help as well in reducing the amount of inhaled particulates that we bring into our lungs. So that is something that people should be doing when they're outside right now. We know for some people there's a lot of, well, for many of us, there's confusion about what is the symptoms caused by the smoky skies and what are the symptoms caused by COVID-19. And that is, of course, very concerning for us in our schools as well as other places. And we know that schools can be a very safe place for people and for children and all adults in the school system. It's a place where you can be protected from both COVID-19 and from the smoky skies. We need to go back to our basics, making sure that we are screening out, and if we have concerns about symptoms, to stay away from school, to make sure that we have our distancing, our hand cleaning, that we close windows in these conditions, and that we use, if they're available, the HVAC systems or in-classroom HEPA filters that some places have. We know that masks are helpful as well for both situations. We want to avoid strenuous exercise outside and limit our indoor exercise as well to low intensity. And for people who do have asthma or other chronic heart disease or chronic lung conditions, to make sure that you have your medications with you, and if you use them, to make sure you carry your rescue medications with you as well. And for anybody who is having difficulty breathing, make sure that you can call 911 to get assistance if you need it. It is also challenging to know if some of these symptoms that we have from COVID are related to the air quality or vice versa. And just as a challenge, things like dry cough and runny eyes and irritation, those can be associated both with smoke and with COVID. But there are things that are not as likely to be caused by wildfire smoke. So anything like fever and chills and the aches and the productive cough and things like that we get with COVID. So that's one of the things that you can use to tell the difference. And we have seen wildfire smoke before. It has been a couple of years, but we know, some of us, many of us, know how we react to this smoke. So if it is your usual symptoms from smoke, you can make sure that you take the actions you need to protect yourself. This is the time for back to school, back to work, back to doing all we can to flatten our COVID-19 curve again. The number of new cases is, as you can imagine, placing a heavy strain on our public health teams and is a concern for me and I know for many of us. We can help our public health teams by doing our part with the choices that we make every day. The symptoms of COVID-19 can be very mild, particularly in young, healthy people. You may think it's seasonal allergies, a mild cold, or now perhaps irritation from the wildfire smoke. But if you have concerns or doubts, stay away from others. Get a test. We have seen that people can easily and inadvertently spread this virus to people they are closest to. And we've seen this in some of the recent workplaces and community exposures. And tragically, we have seen it when we've had celebrations, whether they're celebrations of life, whether it's the coming together that we need to have to celebrate people for funerals, for marriages, and other just getting together because we need that social interaction. We need to go back to our basics now. We need to find ways to celebrate and to include those who may be most vulnerable to COVID-19, but include them in ways that are safe. We need to do this to protect our elders and our seniors. Physically distance and social connection are the terms that we need to remember and go back to. Now is also our time to make sure that that social connection is there It is important for our mental and emotional well-being, but we need to stick to small groups. And that means stick to 6, keep our groups small, and spend time with the people we know. We need to set these routines now so that we can carry ourselves through whatever comes up in the coming weeks and months. We know what we need to do. Now is the time to do it. We need to hold our line and stand strong against COVID-19. And we also, more than ever, need to remember to be kind to each other, to be calm, and to stay safe.
Thank you very much, Dr. Henry, and I wanted to join Dr. Henry and obviously on behalf of the Premier as well, the government, really the people of BC, to pass on my condolences to the families of the 6 people who passed away from COVID-19 in British Columbia this weekend. 5 of them in long-term care in Metro Vancouver, and the first person to pass away in the Northern Health Authority. These are very difficult times. I think Dr. Henry was talking about this, the challenge of grieving, of coming together in celebrations of life at this time of COVID-19. So we want all of their families, all of the caregivers to know how much we're thinking about them and how much we grieve with them on their terrible loss this weekend. As Dr. Henry has noted, we had 5 healthcare outbreaks, 4 in the healthcare system and 1 outside in the community that were declared over this weekend. I just wanted to note, and in the case of George Derby and MSA Manor and Holy Family and the Cerny Alzheimer's Center and obviously the Okanagan Correction Center, we know the stress that the declaration of an outbreak, even an outbreak of 1 person or a staff person from outside, how much anxiety that creates in people who live in long-term care homes in particular, and their families and the staff. So it's truly good news after a very challenging period in those 5 cases to see those outbreaks declared over. There are 58 people hospitalized from COVID-19 in BC, and that's 28 in Fraser Health, 22 in Vancouver Coastal Health, 1 person outside of Canada in Vancouver Coastal Health, and 7 in the Northern Health Authority. And I just note as well the ongoing and extraordinary work of public health during this pandemic. This past weekend, over the 3 days, public health conducted 17,125 tests in BC, and we know that there were 317 of those 17,125, or 1.85%, that were found to be positive, but also 1,594 people who are active cases who are being supported by public health, and 3,047 people under public health monitoring. And so we appreciate the extraordinary effort in all health authorities by public health, by people from Vancouver Coastal and Fraser Health, from Vancouver Island and Interior, the North, and the First Nations Health Authority in supporting people who are dealing with COVID-19 in BC. Every Monday, we provide an update on PPE. And so, as with previous weeks, I'll report on how much PPE has arrived cumulatively since the end of March, and then specifically what has arrived over the past week. To recap our cumulative totals from March to last week's report on Tuesday, September 8th, the following PPE has arrived in BC. Just over 6,300,095 are equivalent respirators, just over 52 million surgical or procedure gloves, just over 2,600,000 pieces of eye protection, including goggles and face shields, just over 115 million pairs of gloves, and just over 8,700,000 gowns. Many of the items I've just listed and other equipment that has recently arrived are in our testing process to make sure product meets or exceeds safety requirements before being used in BC's healthcare system. Today I can tell you that over the past week, since my last update on Tuesday, September 8th, up until yesterday, we've received the following: 91,766 N95 or equivalent respirators, 1,993,300 surgical or procedure masks, 97,850 pairs of gloves, and 603,940 gowns. We'll continue to source and test our PPE and are working to pursue any and all credible leads for safe and effective product in our healthcare system. In wrapping up today, I think that between the changes we've made in our lives for COVID-19 and the smoke from the U.S. fires, many of us may have thought, can we get a break here? It was that kind of weekend, a weekend where more still was asked of us. The actions that people have taken in BC since the beginning of the pandemic, since we declared a public health emergency in March, since we set up our emergency response in January, have truly been extraordinary, and they've had positive consequences. We've made surgical renewal possible. We made visitations, again, for our seniors and elders in long-term care and assisted living possible. We're making back to school possible, back to work possible. We're making our new normal possible. Last week, we learned that our healthcare sector is prepared for whatever COVID-19 might bring this winter. We're prepared with more testing and more contact tracing. We're prepared with a flu immunization effort this fall, the size of which none of us has ever seen. We're prepared with a primary community and hospital care system that's there for all patients, and that includes those with COVID-19 by having assigned COVID beds across 19 designated hospitals. We're prepared by recruiting 7,000 healthcare workers to provide additional support to our seniors and elders in long-term care homes and assisted living facilities. We're prepared by implementing increased in-community testing and timely access to primary and urgent hospital care through emergency ground and air ambulance transportation in rural, remote, and Indigenous communities. We're prepared by reducing the chance for transmission in hospital through hospital at home. We're prepared with our supply of PPE that I've just discussed and our ongoing pursuit of more. And we've learned that our achievement in stopping the spread is closely linked to the success of these health sector preparations and the need for them. We're asking more of ourselves for the weeks and months ahead because we can do it and we must do it. Physical distancing stops the spread and saves lives. Washing our hands stops the spread and saves lives. Wearing a mask when asked to, required to, or when it's the right thing to do stops the spread and saves lives. Staying home when we're sick and letting our public health officials know and contacting them when we're sick or we think we may be sick with COVID-19 stops the spread and saves lives. Letting stick to 6 be our constant guide to the maximum number of people we socialize with outside our household bubble stops the spread and saves lives. So let's remember this about COVID-19. Our health system is prepared, and so are we. Our staying 100% all in has made it possible and will continue to make all the difference today, this week, this month, this fall, and this winter. We're prepared, we know we can do it, we know what we must do, and we know we can do it. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 11 et 12 septembre, celle des 12 et 13 septembre, et celle du 13 jusqu'au 14 septembre en mi-journée. Il y a eu 6 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux 6 familles et aux amis des 219 personnes décédées du COVID-19 et tous ceux qui ont perdu des êtres chers au cours de cette pandémie. À ce jour, 5 446 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence qui s'étend jusqu'au 12 septembre, nous avons eu 137 nouveaux cas. Pour la deuxième période de référence qui s'étend jusqu'au 13 septembre, nous avons eu 119 nouveaux cas. Au cours des dernières 24 heures, 61 nouveaux cas se sont ajoutés. Cela représente 317 nouveaux cas depuis notre dernière mise à jour vendredi pour un total de 7 279 cas en Colombie-Britannique. Chaque régie de santé compte des patients atteints de COVID-19, bien entendu. 2557 se trouvent à Vancouver Coastal, 3754 à Fraser, 195 sur l'île de Vancouver, 473 dans l'intérieur et 216 au nord. Il y a aussi 84 cas de personnes qui vivent en dehors du Canada. Parmi l'ensemble des cas confirmés de COVID-19, 58 sont actuellement hospitalisés, dont 16 en soins intensifs. Les autres personnes dont le test de dépistage était positif sont en isolement à leur domicile. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to reporters on the phone line, please press star 1 to enter the queue. You are limited to one question and one follow-up only. Please also take your phones off mute. You will not be audible until your name is called. First question is from David Molko, CTV.
Minister Dr. Henry, thank you both for making time again. I want to talk about schools and smoke again. We heard calls from the BC Teachers Federation to close schools because of the smoke. That really amounts to concerns over the lack of fresh air, adequate ventilation. Dr. Henry, can you talk a little bit about how you view that ventilation issue? Should there be extra fans, air purifiers? Should students have portable desk fans? Should schools call it a smoke day? I guess what I'm asking is help me understand the science here when it comes to being prepared versus paranoid when it comes to ventilation.
So I think we there's a couple of things around this. We have been through this before, and we know that it's a broad swath of the province that's been affected. And for many people, the school is actually a safer environment than many homes. So yes, it is perfectly safe for people to be in the school, but we don't want the windows open. We want to reduce the amount of smoke that's coming in. And that is something different from what we've been saying, where we want to increase ventilation if windows are available and people being outside because of it reduces the risk of COVID. But we have other things in place for COVID as well. So we need to make sure that we're adhering to those precautions. But when it comes to smoky skies, yes, we want to increase ventilation. If we have that, there's filters that can be used in some schools. Not all schools have that ability. And there are HEPA filters in classrooms as well, portable air cleaners that can be used, and people can use those at home. We know as well some communities have set up areas where they can filter the sky and make it filter the air so that people can have a safer environment to go to, particularly people who are more affected by the smoke. So I would encourage people to do those. We need to maintain our distances and make sure that we're staying apart from each other if you're using those centers.
Do you have a follow-up, David?
I do. I want to ask about outdoor transmission, too. A little bit of a moot point because of the smoke out there. But you've always said, getting together outdoors is better than indoors. Keep our bubbles small, maintain distance, wear masks, so on. Back on August 20th, I asked the Public Health Agency of Canada if they were aware of any confirmed cases of purely outdoor transmission in the entire country. Not exposures alerts, but actual transmissions. And they told me no, not a single case. So I want to repeat that question to you today. Has BC had a single confirmed case of purely outdoor transmission? And either way, what does that tell us?
Yeah, so we have had some. I don't have the exact number, but we have had some events. But globally, there's been reported events that it's much, much less likely. But if you have people in close contact for periods of time, so we've seen some parties and events where there's a social network that is outside, but sharing food and drinks and laughing and dancing and other things like that. So you can do it outside, but you have to have very close contact. The nice thing about being outside, especially if there's a bit of wind or breeze, that it disperses droplets very quickly. So it makes the risk that much less. And that's one of the things that, it's not a risk. We were very worried early on about droplets and droplet transmission and what that meant and the difference between the size of droplets, whether it's an aerosol or a larger droplet. We know that this virus doesn't live as long in smaller droplets. As they dry out and get smaller and we can inhale them deeper into our lungs, this virus doesn't live as well in those ones. It lives better with a little bit more moisture. So it tends to be, that's why we talk about 1 meter to 2 meters. That's the space that the virus lives best in, droplets that are a little bit moist like that. So outside, even if there's a bit of a breeze, it can disperse all of those droplets quite quickly, which means that you're very unlikely to get enough of the virus, inhale enough of the virus that you will get sick yourself. And if somebody's just passing you on the street, even if they're close, the risk is very, very low to non-existent. And we don't have that type of walk-by transmission events that I'm aware of. But we do have events where people are at parties for a period of time when they're talking to each other closely without wearing a mask, where they're sharing food and drinks and other things. And that is a risk environment. And we have seen some of that, but the risk is much, much less. And of the last I looked, which was a few weeks ago, there were several hundred reports of transmission events, and this is how we learn about how things are, and it was 300 of some and only one where it was outside transmission, and again it was a heated conversation over a period of time where people were very close.
Next question is from Vaughn Palmer, Vancouver Sun.
Good afternoon, Minister, and good afternoon, Dr. Bonnie Henry. Question for both of you, really. In the event a provincial election were to be called in the next few weeks, would the two of you continue to do these briefings on the same basis during the campaign?
Well, I can speak to the fact that I'm not involved in an election other than to provide advice to Elections BC about how to make sure we do them safely, and this pandemic, of course, will continue. So my responsibilities will continue to be the same, to provide updates to the public and to everybody in BC about what is happening with the pandemic and what actions we need to take, and we will continue to do that.
I think these briefings are necessary for people in BC. So currently there are 2 in-person briefings, and there continue to be, and I expect there'll be continue to be from some time. That seems to work well, and 3 written briefings every week. And I would expect, regardless of any circumstances, that such briefings would continue throughout this calendar year, probably through much of next calendar year. And alas, because it would be nice to stop having briefings. So I don't want to speculate about what might happen in the election campaign. We are not necessary to briefings. Dr. Henry was away in August at one point, and Dr. Gustafson did some briefing on a significant number of occasions. Dr. Henry is briefed alone, but the important things is that the briefings and the information involved in those briefings will continue to be made available to the people of BC, I think, well into 2021.
Vaughn, do you have a follow-up?
Yes, please. I wanted to ask about the people, the statistic we're getting now every day on the people who are being monitored. Could you say whether all of those people are automatically being tested, only some of them, and how many of the new cases we get every day are coming from the people who are being monitored?
Yeah, so not everybody will be tested. If they have any symptoms, they'll be tested. So this is the contact tracing. We find people who had exposure where this virus could have been transmitted, and we isolate them and support them to get through that incubation period, so 14 days from their last contact. And if anybody has any symptoms, then yes, we test them and we make sure that happens quickly. As well, in certain situations, we test everybody, whether they're symptomatic or not, and that would be settings like long-term care facility outbreaks or clusters that happen in, we've had in correctional facilities, in people who are living in group accommodations, where we know there can be transmission and asymptomatic, or people who are transmitting to others before they show symptoms. So it varies a little bit. It's a very good question. I know that most of the cases are arising from those known contacts. It's about, I'm just from the stats that I get, it's somewhere in the sort of 70% range. Others are people who were not realized to have been a contact, but were able to trace back. And the unlinked cases in the community that we're finding are still less than 20% of the cases that we're seeing. It sometimes takes some time to be able to connect people, but we're maintaining 80% of being able to link people within a few days.
Amanda Hosgood, the Tyee.
Hi, Dr. Henry. Bella Bella is reporting some COVID-19 cases today, and I know that they've been asking for approximate case information. I'm just wondering, is the province working with the community, and is that something you're open to sharing some of those cases that are close to more remote communities?
Yeah, this has been a very challenging thing because, as we know, people move around a lot, and the exposures that have led to cases in a number of smaller or more remote communities have not been related to a neighboring community, for example. And I don't actually have that information in many cases. So yes, we are working very closely with the Heiltsuk First Nation, with the coastal First Nations, and with all of our First Nation leaders through the First Nations Health Authority. Very early on in this, I compelled a data linkage for every single case to make sure that we could identify people by indigeneity, and we notify the First Nations Health Authority, and leadership in an affected community are notified as soon as we know. I will say that in many cases, the community will know before we know when somebody is ill and before they go for testing, because we don't have any way of knowing whether somebody who's traveled is going to become sick. Where we get notified is when the tests come back positive. So we've been working on this, and as we know, I have responsibilities for protection of people's personal health information, and we need to find a way to make sure we meet the needs of First Nations for understanding risk in their communities, absolutely. So yes, we are continuing to work with them on this.
Amanda, do you have a follow-up?
I do. I'm also wondering, the nation asked the province to partner on culturally safe contact tracing. I'm wondering if that's happening and what that looks like.
That's another issue that we've been working with them on, and yes, what we've got is at least in my thinking, what we've been working with the First Nations Health Authority and communities is what we call the circle of support. So the people in the communities that know the needs of the members who are either in isolation because they're sick, or they're in isolation because they've been in contact, and they know what the needs are, who's in contact with who, and we've been working very closely with them, and it's worked very well in some situations, not so well in other situations. So it is still something that we need to do more work on, and we need to make sure that we are, from our Western way of thinking, incorporating things that are culturally safe, so that people are able to come forward and be sure that they are getting the support that they need, both from their community and from us in the public health world. So it is more work to be done, absolutely, and we are committed to doing it.
Our next question is from Keith Baldry, Global News.
Oh, hi, Dr. Henry. Thanks very much for this. On Thursday, I asked you about the rise in hospitalizations, and you said that you weren't overly concerned because they were going up and down and such. Now, since then, we've gone from 42 to 58 with this reporting period, 16 now in ICU, which is up 6. I'm just wondering if you could put this in context in terms of where this is on your sort of concern meter in terms of...
this is what we talked about last week. As we get more cases, the chances of getting spillover into people who are more vulnerable, people who are more likely to have severe illness and end up in hospital, is going up. And we are seeing that. And this is why I've said, we need to take a step back and reset and make sure that we're ready for the fall and that we're doing those things that we know work to protect our seniors and our elders. And we've seen that, particularly in the north now, where we've had our first death from COVID-19. And there are others in Fraser Health in Vancouver Coastal who are in intensive care. And these are people who are older than the younger demographic that was driving a lot of the cases that we've been seeing. So we all need to do our part now to remember how important it is to protect people in long-term care, to protect our seniors and elders and people who have underlying health conditions that put them more at risk. And part of that is making sure that we can have those important ceremonies in our lives in a way that is safe for everybody to participate.
Keith, do you have a follow-up?
Yes, we peaked at 149 hospitalizations and I believe 72 in ICU. Are you worried that we could be approaching those levels again, or is that something that might be just beyond where we're headed?
I hope not. I think we know how to structure our system. We know how to care for people. We're not seeing overwhelming of our health system, but this is the balance we have to find. We need to be able to provide that care for everybody who needs it, but we need to do our best to prevent transmissions to people who are more likely to end up in hospital or ICU.
Next question is from Marcella Bernardo, News 1130.
With what the response was that you just gave to Mr. Baldry, I was hoping to ask you about the concerns being raised by loved ones about their inability to see seniors in care homes. And when you say taking a step back, does that mean still limiting visits so that they're less than 30 minutes a day per one family member?
I know that that has been a huge challenge for many of us, for many family members across the province. And I think we can safely increase our support in long-term care, but we have to do it. And we had, as of today, we still have, I believe it's 13 long-term care homes where we have outbreaks. So we have to do it in a controlled and measured way. And part of that is what we announced last week, making sure that we have staff who are able to support residents. The difficulty we have with long-term care is that it's not just our person who's in there. It's everybody who's at risk. So we all have to do our piece. But no, we don't see us taking a step backward, and we are putting in measures to try and increase the time and make sure that there is the supports in every care home to provide more visits to more people in a safe way.
So obviously this is one of the issues, Marcello, that we hear about most from people because it has a profound impact on both the quality of life in long-term care and the quality of family life. And so it's a very significant question. We've taken a very methodical approach to dealing with it. You know that on June 30th we made an announcement about the visitation policy that allowed for visits, and I hear from lots of people about how important those visits are to them. It's clear that we want as a goal to increase the number of visits, but I think we have to put that in context. COVID-19 is obviously unbelievably harmful and potentially harmful to people living in long-term care. So we've got to continue in a methodical way, in a safe way, to take the actions required. It's why we invested $165.4 million in our single-site proposal to help keep people safe. It's why we integrated long-term care homes into our PPE supply chains really before anyone else in Canada had, why we dramatically increased infection control, and why we've invested $160 million now in attracting more staff to long-term care. All of these will help us over the next year and potentially longer as we deal with these situations. So what we're hoping to do is continue to advance the protection we provide to people in long-term care and then address issues that are significant to quality of life like visits. So that's the effort that's going on right now. I would say that it's fair to say that the visits that have been conducted to date have been positive, that we haven't seen from those visits any cases, and that gives us confidence that we're on the right track, and that this methodical, serious approach that protects people but also understands the importance and central role that family life and social life can play to everybody, never mind people in long-term care, is given priority as well.
Marcella, do you have a follow-up?
I do. Regarding the screening for schools, there have been some concerns being raised now that the protocols have been shifted so that it's not as, I guess, strong to determine whether or not a child or a teacher or another staff member might have been exposed. And if you could explain why that change has been made in the protocols.
There's nothing been changed about exposure. what we have done is clarified that if somebody has their usual symptoms of allergies at a specific time and no other symptoms, then they may not need to leave school. We've also clarified the process to make it. We were learning from our colleagues across the country that it was a challenge, that kids often, young kids especially, would often have a runny nose or something, mild symptoms, and we would send them home. So we now give them a 24-hour period where we see if the symptoms resolve before requiring a test, for example. These are all just nuances, but the screening process is absolutely the same.
Next question is from Mike Hager, Globe and Mail.
Hi, I just wanted to ask about Indigenous communities. It looks like there's been 92 confirmed cases across the province. Is that on reserve? And is there a through line among these cases? You said proximate case info won't really help because it doesn't appear that neighboring residents have led to these the transmission on these reserves. Wondering if there is kind of commonalities between these clusters on reserve.
It includes all people who are identified as First Nations. So yes, it includes First Nations living in community and away from home. And for example, there were a number of First Nations people who were identified in the Federal Correctional Facility outbreak. So it includes all of that. And every story is slightly different. And that's where public health, the First Nations Health Authority, work closely with the community to investigate every single case that happens in community, and whether it's in an urban area or away from home or in the correctional facility and other places. So there's no one story. But I can say that we don't always know where, until somebody turns up as positive, where they were exposed. And sometimes the exposure event and the notification happen at the same time. So it's a very challenging situation. I mean, an example is recently a number of people attended a large memorial service and gathering, and there were exposure events that happened there. People returned to their home community and developed illness. So, I have no way of knowing who was attending those events ahead of time. So it is a very challenging situation, and it's something we're trying to work on, because we know that it's this virus is carried in people, and it's when people move that we bring it to each other and to the community that we come from, and we bring that risk with us when we return home. So and we're most likely to pass it on to those people that we live with, that we have close contact with, and it's hard to quantify the risk by geography without taking into account the fact that it travels with people.
Mike, do you have a follow-up?
Yes, thanks a lot for that. I'm just wondering if you think this dearth of information on the ground is leading to problems. We have the Cathet Regional District saying that Nation members are being harassed in Powell River by people when they enter the community there. And there's a lot of distrust in that area because people don't really know about case numbers. So thoughts on just kind of, the anger and perhaps distress that not knowing where exactly these cases are is creating in certain communities.
Yeah, and this is the challenge. It's not that we're withholding information, it's just that we don't necessarily know. And then we have to put a response together where people can be tested, where we connect the dots in partnership with the community. And this is every community. And it makes me very sad and concerned when I hear that there are bad things happening and the stigma associated with this disease, we have to remember that nobody intentionally brought this disease into our community or our families, and that we know how to deal with this disease, and we need to support each other like we do with every other illness that we have in our communities. And that means taking precautions, making sure that we're doing the right things, and making sure that we're supporting our family members, our community members, to stay home and have what they need should they have to isolate. And that's how we can support each other, and we all need to do that. This virus cannot tell the difference about where we came from, what country we're from, what ethnicity or race we are. And we all need to make sure that we are taking the anti-racist supportive approach with all of our friends and all of our communities.
We have time for one more question this afternoon. For everyone listening, Dr. Henry and Minister Dix release a joint statement every afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for visit bccdc.ca, and for information about the province's pandemic supports, visit gov.bc.ca / Andrea Ross, CBC.
Swapping August. Didn't that end at seniors care facilities months ago with the single site program? And why isn't that a rule across is involved?
Sorry, I didn't hear the first part of this. You said something about the sentence before middle of August.
Was why was the Milieu Children and Family Services Society swapping staff between sites in early August?
Site applies to long-term care homes, and so there's a specific definition. We do know that group homes where people work and support people in multiple different homes, and those are very much homes. They're smaller numbers, smaller medical needs as well, depending on the home. So they would need to take the same precautions that we would take in any other supportive environment like that, with keeping keeping our groups small, making sure we're taking the appropriate precautions. So it's a different single site applies to long-term care.
Andrea, do you have a follow-up?
Yeah, and regarding the first death from COVID-19 in the north, can you tell us a bit more about the circumstances surrounding that death? And can you say whether the person died in hospital, and also if you're...
Sure. This was a woman in her 70s who did unfortunately pass away in hospital and was exposed in the community after attending an event.
Oui, très malheureusement, la femme qui est décédée au nord est morte à l'hôpital. Elle avait plus que 70 ans et la transmission s'est déroulée dans un événement communautaire lié au voyage. Donc, c'est évidemment une situation douloureuse pour la communauté, pour la famille, et on envoie cette personne. Merci. Thank you.
Thank you.